大家好，我叫 John Harry， 来自巴基斯坦的学生。我今年25岁。我2013年来中国学习。我在湖南师范大学学医，我的专业是学医。我现在在湖南省人民医院学习和实习。我获得了湖南省奖学金和湖南师范大学外国留学生奖学金。我跟外国学生上了医学课，我讲的课是自主学、生理学、病理学和生物化学。我在中国跟小孩子们讲英语课。我上英语课的学生从3岁到16岁。我在湖南省人民医院和长沙中心医院跟护士们和医生们上英语课。好，谢谢大家。Good morning, dear viewers. I'm your host, John Harry. Dear viewers, today we have come up with a new topic from the gynecology department. Today we're going to discuss ectopic pregnancy. Now the question will be arising in your mind that what is ectopic pregnancy? What are the signs and symptoms for the ectopic pregnancy? How we can manage and treat this problem, and how we can prevent ourselves from this problem. To answer all these questions, today we have invited Dr. Mini in our studio. Dr. Mini is a great gynecologist, and she is working in the gynecology department in Hunan Provincial People Hospital for almost last 12 years. Good morning, Dr. Mini.
Good morning, Harry.
How are you today?
Fine, thank you.
Okay, thank you very much for your precious time to be here with us.
Yeah.
Now, Dr. Mini, can you please briefly explain what is ectopic pregnancy?
Well, ectopic pregnancy is a condition that the fertilized egg located outside of the uterus cavity.
Okay.
I mean that it can locate it on the fallopian tube, or the ovary, or the abdominal cavity, or even the cesarean section scar. I mean any condition located outside the uterus cavity, we call it ectopic pregnancy.
So it means that when the embryo develops, right?
Yeah.
It is outside the uterus, right?
Yeah.
It is not inside the uterus, right?
Yeah.
Any place outside the uterus is called ectopic pregnancy, right?
Yeah. And the ectopic pregnancy, in most cases, the fallopian tube ectopic pregnancy account for almost 95% of the ectopic pregnancy.
Oh, so means that the most common ectopic pregnancy occur in the fallopian tube, right?
Yeah, yeah.
Okay, that's all right. Now, what are the causes? I mean, why the woman suffer from the ectopic pregnancy?
Well, the most cases, the fallopian tubes, because of the inflammation or infection, which can cause the fallopian tube partially or totally blocked. And the adhesion, because of the cavity, pelvic cavity adhesion, also can impede the egg's movement. And sometimes because of the birth defect or the defect growth, which can cause the defect of the fallopian tube. I mean the abnormality of the tube shapes. Yeah. And these patients who can have the high risk factor, such as the age of the 35 to 44 years old, the PID history, I mean the pelvic inflammation disease history, the IUD or the tube ligation, and in recent years, because of the fertilization technique, these are all can cause the ectopic pregnancy.
Oh, so you mean that the number one cause for the ectopic pregnancy is inflammation, right?
Yeah, yeah.
And the surgeries and the people, the women, the ladies who are gone into the birth in the old age, right? Like 35 and 45, right?
Yeah.
Okay, so these are the most important causes for the ectopic pregnancy, right?
Yeah, of course, if the patient have the ectopic pregnancy previously, yeah, she also can have the high risk factor.
Oh, so the previous ectopic pregnancy, right?
Yeah, yeah.
Okay, previous ectopic pregnancy. Okay. Now, once the woman suffer from the ectopic pregnancy, right? Now, how the woman knows that they are suffering from the ectopic pregnancy? I mean, what are the signs and symptoms for her to know that the woman is suffering from the ectopic pregnancy?
Okay. As for the symptom, the patient, the first one, they may find that the missing period, I mean, the menstruation did not come in time, and accompanied with the lower abdominal pain, and sometimes they can feel very shocked or because of the heavy bleeding internally. As a patient, I think the first the cheapest and effective way for you to know that is to get a HCG test paper from the pharmacy. If the test result is positive, which shows that you are pregnant, you'd better go to the emergency room to do an ultrasound to find whether the fertilized egg inside the uterus cavity or not. If the ultrasound shows no baby inside your uterus cavity, but a mixed mass outside on one side of the adnexal areas, which may be evidence to show that you suffer from the ectopic pregnancy.
Oh, I see. So it means that the first step is to know that whether a woman is pregnant or not, right? And that we can confirm by the HCG paper test, right?
But here I want to emphasize that some patients may confuse by the missing the abnormal vaginal bleeding and the menstruation. Here, I need the patient to describe all the details about the vaginal bleeding to your doctors, include the amount of the vaginal bleeding, the lasting time, the color of the blood, everything in detail. You should explain to your doctors.
So first the woman should be clear about the pregnancy, right? Whether she is pregnant or not. And once the pregnancy test is cleared, I mean it is confirmed that the woman is pregnant. After that, they need to do the ultrasound and other tests to know the location of the embryo, right? Location of the newly developing embryo. Okay. Now, once the woman know that they are suffering from the ectopic pregnancy, once it is confirmed by the different tests, how we can manage this kind of problem?
As a doctor, first, he would like to prescribe the urine or the blood HCG on the patient to make sure whether she is pregnant or not. Then the ultrasound will show the evidence just like I explained right now. And the doctor will do a pelvic examination on the patient. The ectopic pregnancy patient will suffer from the lower abdominal pain. I mean that when the doctor do the pelvic examination on the patient, the doctor can feel the tenderness of the uterus, and sometimes the doctor can also feel the mixed mass on one side of the adnexal areas. And in most cases, the doctor will communicate with the patient that whether she can she can do the cardiocentesis on the patient. Cardiocentesis is a prefrontal word, which means that use a needle, put the needle inside of the pelvic cavity through the posterior fornix of the vagina to see whether the doctor can get the uncoagulated blood or not. If the test is positive, I mean that the doctor get the uncoagulated blood inside, that is the strong evidence to show that there is internal organ bleeding. So it means that we do this test, right? Cardiocentesis, to confirm that there is internal bleeding, right? And that bleeding is due to the ectopic pregnancy, right? In most cases. So once it is confirmed that there is bleeding and a woman has the ectopic pregnancy, so what are the steps we need to take to take care of the health of this movement, to prevent the death or some more complications? You mean the treatment for
treatment?
The
yes, exactly. Treatment plan.
Usually, at first we use the expectant treatment. I mean that the patient should be monitored very carefully. If the fertilized egg cannot dissolve itself, then we need to take the first the following steps. In most cases, surgery way is a very effective way. The doctor will communicate with the patient whether she had the birth will in future. I mean that if the patient have the birth will in future, the doctor will try the best to keep the whole fallopian tube. Only get the pregnancy tissue outside. But if the patient have no will to have baby in future, you'd better follow the advice of the doctor to cut down the fallopian tube.
To cut down the fallopian tube as a whole, to remove it, right? Clearly.
Of course, if you are in this condition, I mean the vital sign is stable, not severe, the lower abdominal pain, and the low level of the blood, 0 HCG, then and the size of the mixed mass is no less than 3 centimeters. You also can choose the drug treatment.
Okay, so it means that we when we do the ultrasound, right? And we see the size. We see the size of the developing embryo. If it is less than 3 centimeters, we can use the medical treatment. We don't need to do the surgery, right?
Yeah, and of course with the low level of the HCG, usually it should be low than 2,000.
2,000 microgram, right? So it means that if the level of HCG is low and the size of the developing embryo is less than 3 centimeters, we better choose the medical treatment, right? Okay.
And usually the doctor will prescribe the mifepristone or the MTX,
methotrexate,
which are very useful drug to cure the pregnancy tissues.
Okay.
Of course, there are advantages and disadvantages for both of the surgery way and the drug way. As for the surgery way, it's very effective and it can shorten the day of your hospitalization. But it can cost you a lot of money. As for the drug way, it may take you a long time to stay in the hospital, but cost you less money.
So the both method, either we use the medical way to treat the patient with the medicine, or we do the surgery way to cut the fallopian tube and this. So both these methods have their own consequences, right? And all their benefits, right? Okay, that's right.
Anyway, which way you need to choose at the treatment, you'd better follow the advice of your doctors.
Follow the advice of your doctor. They know the best, right? And they can choose the best way for you. I see. So that's great. Thank you very much, Dr. Mini, for your great explanation. Thank you.
You're welcome.
Dear viewers, as you have seen that Dr. Mini have explained the ectopic pregnancy in a good detail. I hope you must get a lot out of it. Now, if you have any question or suggestion, you can email us. So see you next time with a new topic. Till then, take good care of yourself and your loved one. Stay tuned. Have a good day. Bye-bye.
Bye-bye.